Hey everyone, I'm Elise, the occupational therapist making stroke information simple. Today we're going to talk about anxiety and panic attacks. Mental health after stroke was one of the top voted topics in some of the polls that I ran on Reddit, Facebook, LinkedIn. So I want to first of all thank everyone who participated in those polls because you guys are letting me know what type of content you want me to cover. And I want to thank all of my new subscribers. Thank you so much for coming on this journey with me. I am still learning how to do this and be a content creator on YouTube, so I look forward to learning together as we move through this. What is anxiety? I think most of us have experienced that at some point in our lives. I wanted to share that although I am not a stroke survivor, I'm an occupational therapist who works with stroke survivors. I am a mental health patient. So in 2012, I was diagnosed with generalized anxiety disorder and panic disorder. I bring that up to let you know that this is a subject that's really close to my heart. So there was a study from 2006 that looked at the occurrence of different mental health disorders in stroke survivors. And 20 to 30% of the participants they looked at in that study dealt with post-stroke anxiety. I just want you to know that it's pretty common and pretty normal to experience feelings of fear, anxiety, and even panic after having a stroke. I think it's important to realize that you have been through a trauma. Not only just the trauma of the actual brain injury, but the emotional and mental trauma of having this life-altering thing happen to you. I'm sure you've heard of the fight or flight response at some point in your life, and anxiety and panic turn that response up to 11 in response to things that normally shouldn't make you feel that way. Try visualizing a bell curve when you think about anxiety. So you have kind of the flat part at the bottom, rising up like a mountaintop, and then coming down to the other side. In that before section, that's when we have little to no anxiety, which can decrease our drive and motivation. Because when we get to the top of the bell curve, that's what we consider the just right amount of anxiety. And that can help us do better on tests or do better to work towards a deadline at work. When we come down on the other side, that's where we get so much anxiety that we're not able to be productive and do what we want or need to do. Generally, what you're working through when you have a mental health diagnosis of anxiety or even panic attacks is dealing on that other side, where you have got so much of those anxiety symptoms that you're not being able to do what you want and need to do. Speaking of panic attacks basically take anxiety up to a whole other level. The symptoms of a panic attack are significantly more severe than just generalized anxiety. You're typically going to have heart palpitations where your heart is beating so fast and racing. You're going to have short, shallow breaths that can result in hyperventilation. And you might also have numbness and tingling in your face, your arms, your hands, your legs. Symptoms can be so severe that it can make you feel like you're actually having a heart attack or that you are dying. Back when I was first diagnosed, I actually ended up going to the hospital. I was having a panic attack. I did not realize it at the time. I thought I was dying. So they are very severe, and they're very real to the person who is experiencing them. What do we do about having anxiety and panic attacks after a stroke? These first two things might be pretty obvious, but they bear repeating. The first step is make sure that you're talking with your doctor. Your doctor can't help you if they don't know that you're having these issues. Depending on the level of your symptoms and the severity, they may want to try you on different medications. It's important to note that these medications take time to build up in your system, and I'm sure that your doctor will discuss this with you, but it's important to not give up those medications if you don't see changes right within the first week or two. The second thing that you should do is talk with a mental health therapist if you have access. I know in the United States it can sometimes be difficult to get access to mental health care. If you have difficulty with access to a mental health therapist or your insurance plan doesn't cover mental health therapy, you can also look into apps like BetterHealth or Talkspace. I am not sponsored by either of these apps. I just think that what they do is incredibly beneficial. Now that we've covered the two most obvious things that you should do, I want to cover the 4 specific things that you can do for anxiety. The first is to identify your anxiety triggers. By identifying the things that make you anxious in the first place, you can either limit your exposure to those triggers, or you can make a plan for what you're going to do if you run into one of those triggers to more successfully deal with them. And by looking at them more objectively, you can try to problem solve through a better, more positive way to react to those triggers. The second anxiety-specific tip is to practice mindfulness. I know this might seem a little bit woo-woo or a little bit new age, hippie, but there's actually a lot of research behind it that shows its effectiveness in treating mental health conditions. The reason mindfulness is so helpful with anxiety is it shifts your attention and your focus onto the present moment. With anxiety, we tend to focus on negative things that have happened in the past, or we tend to worry about things that haven't happened yet in the future. Mindfulness puts our attention back in the moment versus us thinking about those negative things that have happened or worrying about the things to come. The third anxiety-specific tip is to engage in relaxation strategies. Now, this could be an entire video in itself. I'm going to cover 2 points that I think are the most accessible and easy to do. The first is doing deep breathing from your diaphragm versus up here in your shoulders and your chest. And the second is visualization. Again, that might sound a little bit of hippie, new age, but visualization allows you to picture yourself in a relaxing setting. For me, that's curled up under the blankets, reading a good book, and I can close my eyes and go to that relaxing space. Think about your happy places and the places that you can picture in your mind's eye. Close your eyes, take a couple deep breaths, and go to that happy place. The fourth anxiety-specific tip is to exercise. There's a lot of research on how and why exercise makes us feel better, and it's because it releases feel-good hormones, endorphins and dopamine, when we engage in physical activity. Now, the caveat to this is those feel-good hormones are only released for around 24 to 48 hours, so you have to keep exercising every day to get those benefits. Now let's move on to 3 specific tips for panic attacks. The first is using distraction. It's important to note that this is not a long-term fix. Distraction is going to help you in the moment, moment by moment. If you start feeling the symptoms of a panic attack, you can immediately just put on a funny television show, put on some relaxing or soothing music, and see if that distraction helps to divert your mind away from those symptoms that you started to experience. The second panic attack specific tip is to engage in deep breathing. Doing deep breathing from your stomach and your diaphragm versus up in your chest actually helps to stimulate your vagus nerve. This is important because it actually throws into effect your rest and digest system, which is the opposite of your fight or flight system. So it can actually produce physiological changes to combat that short, shallow breathing and help to calm your heart rate. The last panic attack specific tip is to utilize cognitive behavioral therapy. It's something you should really work on with a mental health therapist. But the underlying idea of cognitive behavioral therapy is to take negative thoughts, turn them into something more positive so that we have a better behavioral outcome, meaning that we have less anxiety or we don't go into a full-blown panic attack. Some small pieces of cognitive behavioral therapy that you can use if you're starting to have a panic attack is tell yourself, this is going to pass. I know that I'm feeling this way. It's not nice, it's not pleasant, but it will pass and I'm not going to die from it. I hope that this short introduction was helpful. If you found successful ways to deal with anxiety and panic, leave me a comment. It might be helpful for others in the comments to see what's been successful for you. Remember, it's normal and it's common to feel anxiety and have panic attacks after having a stroke. You're not alone. It's also important to remember that it will take some time to build up that muscle to help you get through these things. But you can do it. Thanks so much for watching. Hit the subscribe button and click the bell if you'd like to get notifications on when new videos are posted. I'll see you guys next time.